What if I told you that one of the deadliest cancers often gives subtle warning signs months before diagnosis, yet most people completely miss them? Pancreatic cancer is responsible for more deaths each year than breast cancer, yet it receives far less public attention. And here's the most alarming part. The 5-year survival rate is only about 11%. Not because treatment is impossible, but because most cases are discovered far too late. Every year, more than 60,000 Americans are diagnosed with pancreatic cancer. But studies show that nearly 75% of patients don't recognize the early symptoms until the disease has already progressed to an advanced stage. The shocking truth? Many of these warning signs appear months before diagnosis. They hide in everyday symptoms people often ignore. Your pancreas is a small organ, roughly the size of your hand, located deep inside your abdomen. Even though it's hidden, it plays a critical role in keeping you alive. It produces hormones like insulin and digestive enzymes that allow your body to process food and regulate blood sugar. Because of its deep location in the body, pancreatic problems are often difficult to detect early. That's why recognizing these symptoms could make a life-saving difference. Today we're going to reveal 8 warning signs of pancreatic cancer that many people overlook. Some of these symptoms are surprisingly common, and according to research from Johns Hopkins, recognizing just 3 of these symptoms together may increase early detection by nearly 68%. But before we continue, a quick disclaimer. This video is for educational purposes only and not medical advice. Always consult a healthcare professional if you have concerns about your health. And if you find this information helpful, make sure to like the video and subscribe so you never miss important health updates. Now let's begin. 1. Dark yellow or brown urine. Your urine color can reveal a lot about what's happening inside your body. When pancreatic cancer blocks the bile duct, a condition called jaundice can develop. This occurs when a substance called bilirubin builds up in the bloodstream. Normally, bilirubin is processed by the liver and removed through your digestive system. But when the bile duct becomes blocked, the body tries to eliminate bilirubin through other routes, including urine. As a result, urine may become dark yellow, brown, or tea-colored, even if you are well hydrated. Many people assume this color change is simply dehydration. But if the dark color persists for several days, it could signal a serious underlying issue. Interestingly, this change in urine color often appears before the yellowing of the skin or eyes, which are the more recognizable signs of jaundice. 2. Persistent stomach or back pain. Pancreatic cancer pain often feels different from a typical stomach ache. Many patients describe a dull, persistent ache deep in the upper abdomen. What makes this symptom unique is that the pain often radiates into the back, creating a band-like sensation across the torso. This happens because the pancreas sits near a network of nerves and organs. As a tumor grows, it can press against these structures and trigger pain signals. The discomfort may worsen after eating or when lying flat. At first, the pain might come and go, but over time, it often becomes more constant and intense. 3. Gas, bloating, or feeling full. Quickly digestive discomfort is another common early symptom. The pancreas produces enzymes that help break down food. When pancreatic cancer disrupts this process, digestion becomes inefficient. You may start feeling uncomfortably full after eating only a small amount of food. This is known as early satiety. Bloating may also occur, making the abdomen feel tight or swollen. Unlike normal indigestion, this type of bloating doesn't improve much with antacids or dietary changes. If persistent bloating continues for weeks, it should be evaluated by a medical professional. 4. Swelling of the gallbladder or liver. Pancreatic tumors can block the bile duct that connects the pancreas, liver, and gallbladder. When this pathway becomes obstructed, bile begins to build up. This causes the gallbladder to enlarge and may also lead to liver swelling. Doctors can sometimes detect this during a physical exam as a firm area under the right rib cage. Imaging tests such as ultrasounds or CT scans often reveal these changes more clearly. These organ changes provide important clues that help doctors identify pancreatic problems. 5. Unexplained blood clots. One of the most surprising symptoms of pancreatic cancer is its connection to blood clots. The disease can trigger a condition known as hypercoagulability, where the blood becomes more prone to clotting. This can lead to deep vein thrombosis, often occurring in the legs. Symptoms may include swelling, redness, warmth in one leg, If part of a clot breaks loose, it can travel to the lungs and cause a pulmonary embolism, a life-threatening emergency. Signs of this include sudden shortness of breath, sharp chest pain, rapid heartbeat. These symptoms require immediate medical attention. 6. Fever and chills. Pancreatic cancer can trigger episodes of fever and shivering due to inflammation. These temperature changes may appear suddenly and then disappear, only to return later. This pattern can confuse many people because it doesn't behave like a typical infection. The fever may also occur alongside night sweats and general discomfort. If recurring fevers persist without a clear cause, they should always be investigated. 7. Extreme fatigue and weakness. Cancer-related fatigue is very different from normal tiredness. Many people with pancreatic cancer describe an overwhelming exhaustion that doesn't improve with rest. Even small tasks may begin to feel difficult. Climbing stairs, carrying groceries, or completing daily chores may suddenly require much more effort. This happens because cancer cells compete with healthy cells for energy and nutrients. The result is persistent weakness and physical fatigue. 8. Digestive problems. The pancreas plays a critical role in digestion. When cancer disrupts enzyme production, food may not break down properly. This can lead to symptoms such as nausea, vomiting, loss of appetite, unintentional weight loss. Another unusual sign involves changes in stool. Stools may appear pale, greasy, or unusually foul-smelling. This occurs because fats are not being properly digested or absorbed. These digestive changes can significantly affect overall nutrition and health. Pancreatic cancer is difficult to detect early, but your body often sends warning signals. Recognizing these 8 symptoms could make an important difference. If you notice several of these signs appearing together or persisting over time, don't ignore them. Talk to a healthcare professional. Early evaluation can sometimes lead to earlier diagnosis and better treatment options. If you found this information helpful, please like the video and subscribe to the channel for more important health insights. And in the comments below, tell us, which of these symptoms surprised you the most? Your feedback helps us continue sharing life-saving information with more people. Thanks for watching, and we'll see you in the next video.